Hi everyone, welcome back. This is the second video on chapter 10, and we're picking up where we left off, and I'm going to do a couple of things different to try to improve our video picture quality, but just bear with me. This will get better and better as time goes on. So where we left off, and I'm going to back us up one slide here so it kind of flows through. Remember, we had our think slide here, and I'm not going to read this. I'm just going to quietly go through it again, but this is where we left off, okay, from our first slide in chapter 10. Okay, so here's our next slide, and we're talking about performing a venipuncture, right? And you never want to tell a patient it's not going to hurt. You never want to tell a child it's not going to hurt. Because it does hurt, but it's not horrible, and you just want to tell them they're going to feel a little stick. And remember, use your textbook also during this time. If you look on, chapter 10, there's lots of good, useful pictures, information. Read those chapters. So I'm going to move in right here, and I'm going to get this slide on the screen so you guys can see it. And like I said, use your rewind, pause, and all that to not only see the screen a little bit better, to fill out your study guides and all that. So the things we want to take away right here is that 30-degree angle, anywhere between 15 and 30 degrees, running in the same direction as your vein, right? Also, you've got to remember that if you don't get these angles right, you're either going to scrape across the skin, which hurts, and you're going to usually not get into that vein, or you're going to go straight through that vein, okay? And you don't want to do that because you run the risk of hitting a nerve or a tendon, okay? So then this is talking about, we're going to move on and talking about a winged infusion set. So again, I'm going to move our camera in, so that we can get a little bit better of a quality video picture here, okay? And then we will talk about this, and not only this, but really refer to your chapter 2. They have a lot of pictures and a lot of great information in chapter 10. We want to talk about when you don't get blood flow initially, either with a winged infusion set, with a syringe, with a straight needle, or with your vacutainer system, you can reach up with your index finger of your non-dominant hand, and you're going to just slightly feel and palpitate to see if you might be a little to the left, a little to the right, and then you can reorient your needle with very slight, minute movements, okay? You never want to probe around in somebody's arm, okay? You always want to make sure that you remove that tube from the inner needle on your vacutainer setup before withdrawing the entire needle out of the arm. And you do it with a little twist and pull motion, okay? And you always want to be real careful with that winged infusion set. It contains air, so it could underfill one of your tubes by about 0.5 mLs, and it could affect your additive to blood ratio. That's why we use a discard tube when we're doing coagulation draws. And we'll get into more of that later, and we've talked about this before. Okay, so here's another one of our thinking slides. Okay, so make sure you're getting that piece of paper out. Make sure when you see this slide, you're pausing it, writing down what you think, and making sure that you are putting all these pieces together and you're making sense of this, so that when you go out in the field and you're working as a phlebotomist, you're able to put all the things you learned together to be able to do the right thing. So our little think slide here, it says, if a physician ordered a PT test, how should blood be drawn? You would draw one light blue top tube, right? Now, if a physician ordered a PT test, what color top tubes should be drawn when using a winged infusion set? Now, right off the bat, that's giving the tubes that there's more than one. But we're aware, right? What are we aware of? What have we learned? Okay? We've learned that a red discard tube should be drawn first. and then the light blue top tube. And we learned this because we learned that there's air in the tubing of that winged infusion set, which would make us have a minor short draw on that light top tube, which we always want those tubes, like our purple top and our light blue top, need to be 100% full. But we are very cognizant of this when talking about the light blue because of coagulation studies. And we want to make sure we get the exact right combination of our anticoagulant and our blood in these tubes. So that's why we use that discard tube. So does the discard tube have to be filled all the way? No, just enough to get the air out of the line. Okay, that's all we're looking for. However, if a physician ordered a PT and then an electrolyte profile, what color top tube should be drawn if using a winged infusion set? Now we got two issues here. First of all, he ordered 2 tests, and we now know that if a doctor orders a PT and you're using a winged infusion set, you must draw a discard tube, okay, which is a red top tube. We also know that if the physician orders a PT with any other test, even if you're not using the winged infusion set, you must draw a discard tube, okay? So here, we're going to draw the red top tube as our discard tube and then the light blue. Now, the good thing is the red top tube can be used for our electrolyte panel. Does the discard tube need to be filled all the way? Not necessarily. If it is a difficult stick, half full is sufficient. Okay, so moving on, we're talking about evacuated tube systems and winged infusion systems, or the butterfly method, and I'm going to move the camera in a little closer just to get a little bit better of a shot of the screen for you guys. And again, please make sure you're checking in with your textbook, because there's some very good pictures with descriptions with a lot of great info on page 348 and 349 dealing with, both your winged infusion set when drawing in the arm and in the hand. So make sure that you take a look at all those really great pictures and info in your textbook. So you want to use any healthcare worker using the butterfly needle apparatus needs to be careful because it's got that tubing attached to it, and it can recoil back and unexpectedly and cause you to stick yourself with a dirty needle. It is one of the most hazardous systems we use. That's why we try not to use it too much, because we have a much higher incident of needle sticks. Winged infusion systems or setups or butterfly needles, there's lots of names for it, you'll see. We use those when we're dealing with really small veins, and then if we're moving to the hand or wrist to stick a patient. We got older patients whose veins are not anchored really well and they roll a lot and their skin's very thin. Of course, pediatric patients, burn patients, and you can read out the rest of these. There's numerous reasons why you would use that butterfly needle. You would just really need to use extra caution when using it because it has a higher incidence of needle sticks. So still sticking with dealing with the winged infusion set, it usually comes with very small needles, 23 gauge typically. And remember, the higher the gauge, the smaller the needle. And we also want to keep in mind, if that's a really small needle, then we need to use a smaller vacutainer tube. Because remember, the larger the vacutainer tube, the more rapidly it's going to pull that blood in. And so the smaller the needle, the smaller it has to come in through there, so you're running the risk of pulling those cells through there and tearing them up and hemolyzing your specimen, okay? So, another one of our thinking questions. What would be the best vacutainer tube size to use with a 23 gauge winged infusion set? We have pediatric tube, 4 ml, 7 ml, or 10 ml. The pediatric tube, because it's the smallest, right, of all the vacutainer tubes. Now, there you may be in a situation where you don't even have access to the pediatric tubes, probably unlikely, but it's always possible, or you need more blood than what you can get from that pediatric tube. Then you would move to the smallest tube above that, which is usually a 4 ml or 4.5 ml. So now moving on to the syringe method, and like I said, make sure you're checking with your in your textbook, because there's a lot of great pictures and information. If you look on page 351, 352, and 353, there's a lot of great information on this. Syringes pose hazards. You know, that's one of the reasons that it is not routinely used for venipuncture. You have to transfer that blood from the syringe into the vacutainer tubes, and not only does it pose hazards for accidental needle sticks, but also from carryover of the anticoagulants and additives in the tubes, and also if you delay in transferring, clotting can start occurring in that syringe, which then could give us some erroneous results. Okay, now you can control how hard you pull back. That is one of the benefits of the syringe, because you can control that, and that way you don't end up causing issues with your collapsing your veins or hemolyzing your specimens. But also, if you don't take great care in pulling that plunger back at a safe rate of speed, you can also do just the opposite of that, and you can collapse that vein and hemolyze that specimen. So we're putting our thinking caps on, and we say, why might clotting occur in the syringe if transferring the blood to the vacutainer tube is delayed? Because obviously there's no anticoagulant in that syringe, and because there isn't, those platelets are going to start to try to aggregate and clot. If you had to draw blood from the hand of a very sick elderly patient with tiny veins for a CBC, what would be the best equipment to use? A syringe, because it gives you the most control over the suction exerted. Then transfer the blood from the syringe to a purple top vacutainer tube using a transfer device. And we can see in our textbook on page 353, it has a very good A and B picture of using that transfer device to get your blood out of your syringe into your vacutainer tubes, and it shows you what not to do. So make sure you're checking with that in your textbook. Why should a syringe be used for drawing blood every time? Why shouldn't a syringe be used for drawing blood every time? They are more hazardous because the blood must be transferred to the vacutainer tube, and the blood may clot in the syringe if the procedure takes too long. So we're going to move in with our camera on this screen just so y'all can get a better look at it, and you can pause that. Okay, so moving on. Okay, so when we have a failure to collect blood after a venipuncture, if blood does not flow immediately after you go into the vein, things that you can do, and like I said before, these are very minute, very gentle, slow movements. You can either pull that needle gently outward, you can push that needle gently forward. These are just little minute movements you can do to get yourself better in that vein. Another thing that you might want to do, and guys, this is why when I'm talking to you in lab and we're talking about drawing blood, I always say, please visualize your specimen, your where your vein is, which way it's running, how deep it is, and those kinds of things, so that you can visualize that, and it helps you better when you enter that vein to know if you went in too far or if you're not in far enough, and it really will help you. Always remember also to replace the tube, okay? The vacutainer may be bad. These should be minute movements when you're doing all these things so that you minimize the risk of complications, but sometimes those tubes do go bad, and you might want to remove that tube and just to put another one in there to see if that's what the problem is, if you feel like you are in that vein. And that's another thing. That's why we always check our tubes before we ever start to go out to see our patients, to make sure they're not expired or anything of that nature. So here's another one of our thinking questions. So often phlebotomist jobs in doctors' offices are sought after because of the time. They get to work 8 to 4, 8 to 5 hours, and usually they don't have to work holidays and weekends and things of that nature sometimes. However, one disadvantage to working in a doctor's office is that you are often the only phlebotomist. If you insert the needle into the patient's arm and don't get blood, what are some acceptable things you can try? Push a little further, pull out a little bit, turn the tube in the arm, or try a new vacutainer tube, right? Is it ever okay to dig around until you find a vein? Absolutely not. I'm going to move in a little closer on this slide. Like I said, you guys can pause this, rewind it, go back and watch it again. But we never want to dig around in a patient's arm, right? Never. These are small, minute movements that we do just to see if we can get blood flowing into our syringe or our vacutainer tube. So still talking about that syringe method, and like I said, you check those pages in Chapter 10. You always want to make sure that syringe is oriented so that you can see the graduated marks on it, because before you even get started drawing your patient, you always have to critically think this stuff through. You know, what did this doctor order? How much blood am I going to need? Does this tube have to be 100% full? Can this tube be halfway full? How much blood am I going to need? So that you can see those marks. And you always want to pull back a little bit more than what you need. You also want to make sure that when you're using your transfer device to transfer your blood from your syringe into your tubes, you want to do it in the correct order of draw. Okay? You want to fill each tube from that syringe. Do not push that plunger down to expel that blood. The tubes will fill because of the vacuum in the tube. Let that happen. Otherwise, you're running the risk of hemolyzing your specimen. Now, talking about order of draw, you know, I have that colored flower for you guys that you should be studying to kind of help you, good study methods to help you remember this. It's vitally important, okay? So I'm going to move in on this one a little bit so you guys will have a better visual there that you can see, okay? And then we're going to talk about this. So the specific order of draw is used, we want to use this because we're trying to reduce the effects of additive carryover, okay, or cross-contamination from one tube to the next. The Clinical and Laboratory Standard Institutes recommends the following specific order when collecting blood in multiple tubes. And remember, it's yellow. Remember our sun in the sky on our flower picture? That's always drawn first no matter what. Those are blood culture tubes. Or blood culture vials would be the same as the yellow. Then you have your light blue for your coagulation tubes. Then you have your serum tubes, with or without a clot activator or gel, like your red, your tiger top, your gold, your speckled, whatever it may be. Then you have your green top tube that has the heparin additives in it, coagulations. And then the EDTA tube, which is purple or lavender. And then your glycidic inhibitor tube, which is gray. Okay? Okay, another thinking question. The physician ordered a CBC, renal profile, and blood cultures on a patient. How should the blood be collected? Blood culture is always first, right? Whether you're drawing in the yellow top tube or any type of blood culture vials. And remember, I've showed you that in lab. They come in multiple sizes and shapes. Then green is best because it has an anticoagulant, so we do not have to wait on it to clot, and we can spin it down immediately. And then our purple top tube. Okay, I'm going to go back to that one time. I'm going to zoom in just a little bit here. You guys can see that real quick. Okay, there we go. Now, so moving on, we're talking about special considerations for the coagulation testing. This is, remember we talked about winged infusion sets, and if we're doing coagulation tubes, then we needed to use a discard tube, which a red top tube would be our discard tube. You don't have to fill that discard tube all the way up, but if you are using it for another test, then you want to have it at least halfway full, right? Okay, and remember we're doing that because we want to pull all that blood into that tubing, because we do lose some of the draw initially with the air that's in that tubing of that winged infusion set. Okay, so when the syringe method is used, the blood specimen from the second syringe should be used for the coagulation tube. Okay. And then whenever coagulation test, PT, INR, PTT, or the sole test ordered, and you're using the vacutainer system, accurate results can be obtained from just using one light blue top tube. Okay? So we only need to do this if we're ordering more than one test, or we're using a winged infusion set or a syringe method. Okay? So other coagulation studies such as fibrinogen or factor assay, may be affected by a single tube draw, so it is advised to draw a discard tube first on those as well. Since coagulation tests require a specific concentration of sodium citrate, which is the anticoagulant in the light blue top tube, overfilling the tubes will cause a short clotting time, and underfilling the tubes will cause a prolonged clotting time. Underfilling is the most common error, okay? And we want to avoid this error because we know that our doctors are using their lab results to diagnose, treat their patients and monitor their patients. And we want to make sure that when they're treating, monitoring, or diagnosing their patients, they're getting the most accurate lab result humanly possible. That's why the job that you do is vitally important, and we want to make sure we're doing it the correct way. So we want to make sure small size evacuated tubes, 2 mL or less, may be more sensitive to under or overfilling. Okay? We just want to be aware of that. And immediately after filling, coagulation tubes should be mixed gently, not shaken, 3 to 4 times, which can lead to platelet aggravation and shortening of time. If you mix it more or you shake it vigorously, not only is that something you just don't want to do with any tube because you're running the risk of hemolyzing your specimen, but as those platelets rub up against each other or up against the tube, you're just causing them to start to activate, which will shorten your clotting time. So shorter in mixing on this light blue top tube, and be very gentle with it, please. So here we have a physician ordered a PT test. How should the blood be drawn by Vacutainer? In one light blue top tube, right? Because we're using the Vacutainer method, and he or she only ordered a PT. So since there wasn't another test ordered with it, and we weren't using a syringe or winged infusion set, one light blue top tube is all we need, okay? So make sure you're putting these things together and you understand this, okay? If a physician ordered a fibrinogen test, how should the blood be drawn by Vacutainer? Okay? A discard tube, then a light blue top tube, because we have more than one test ordered, right? And if a CBC and a PT test were ordered and the blood must be drawn by 2 syringes, how should the blood be drawn? Draw 2 syringes full of blood. The first syringe full of blood should be transferred to a purple top tube. The second syringe full of blood should be transferred to a light blue top tube. Okay, so again, I'm going to move in on this slide so that y'all get a really good shot of it, okay? So just try to understand this, because you guys know this is going to be on a test, okay? So make sure you understand the reasons why you would use a discard tube dealing with coagulation tests, okay? So some other issues related to filling the blood using collection tubes, okay? So again, make sure that you're checking your textbook. There's a lot of really good information in here on order of draw on page 355, and just a lot of really good information in here that will really help you be prepared for not only this test, but for classes you'll have in the future and for your registry, okay? So during venipuncture procedure, care should be taken so that additives present in the tube does not come in contact with the inner needle as the tubes are changed out. To minimize transfer of the anticoagulants from tube to tube, the tubes can be gently tapped to remove the additive to the bottom of the tube. Also, holding the tube slightly downward during blood collection is recommended. Okay? So now, it is recommended that blood from serum iron be collected before other specimens while chelating of the anticoagulants such as EDTA. The iron tends to bind to the EDTA. which would mean it would falsely lower the serum iron in a blood test. So that's why we would never want some of that EDTA to have a crossover effect into one of our other tubes. Also, since electrolyte determinations, including potassium and sodium, it is important to collect specimens that require EDTA, which is usually bound to sodium and potassium, afterwards, because it would increase the sodium and potassium test values. Okay? This is why the order of draw is so important. Okay? So specimens should be labeled immediately at the patient's bedside or ambulatory setting prior to leaving the patient. Remember, we're talking about specimen identification and labeling. And remember, we talked about this earlier. We never, ever label a tube before we draw it. And we make sure that we immediately label our tubes after we've drawn them from our patient, right? Tubes should not be pre-labeled, like I said, because if they're not used, somebody might erroneously pick them up and use them on somebody else, and there's where your problem lies. The healthcare worker should ensure that all the information on the label and requisition form is complete and correct before leaving the patient's side. In some cases, the orientation of the label on the tube may be specified because of automated processing. So that's what happens when you do your training at wherever you're working, because some may want it one way and some may want it another, because it depends on how their machine reads the label. If a healthcare worker cannot obtain a specimen, he or she should document that situation. So caring for the puncture site. Now we moved on to that, okay? So caring for the puncture site. So a dry sterile gauze should be applied over the puncture site with firm pressure for several minutes or until bleeding has stopped. Do not use cotton ball, because the cotton fibers tend to stick to the puncture site and pull off that blood clot when they're removed. If the patient continues to bleed, because you're going to peek under there after you've held pressure for a while, make sure it stopped bleeding before you apply your Coban. If it has not stopped bleeding, you want to make sure you notify a nurse or a supervisor. Okay, never leave that patient alone if they have not stopped bleeding without notifying somebody. Needles, lancets, syringes, tube holders, and other bloodletting devices should be used only once, then immediately discarded in a proper container. Shearing or breaking of contaminated sharps is illegal and strictly prohibited. Bending, recapping, or removing contaminated needles is not acceptable. Okay? Alright, so we're going to stop right here, and we'll pick up with monitoring blood volume acquired by venipuncture. And this is when we talked in our capillary sticks why we use skin puncture at times when we talk about anemia and blood volume and things like this. So this is where we're going to pick up on our next video for Chapter 10. So you guys, email me if you have any questions or concerns, and please make sure you're reading your chapters, filling out your study guides, studying this material. Like I said, our next test will be on chapters 11, 10, and 9. So if you finish taking your test 3, you should be quickly getting into this, quickly reading your chapters, filling out your study guides, and beginning to study. Okay? Like I said again, email me if you have any questions, comments, or concerns, and make sure you're watching these videos in order. Thanks a lot, and have a great day.